Hi everybody, I am very glad that quite a few people are viewing my orthopedic classes. So, in continuation of what I have been talking to you all people, today I am going to brief you. Things are very important when we talk about X-rays. For example, one important thing is patient comes to an orthopedic surgeon with X-rays taken elsewhere. They might have been wrongly reported, or as I have said in the beginning, quality might have been poor. With all those things they come and confront us with questions like I have fracture or not and all that. So once again I repeat, don't entirely depend on an X-ray that is brought from outside, because sometimes the X-ray may be good and the wrong part might have been taken. A typical example, the patient was complaining of pain in the buttocks and an X-ray of the pelvis was taken. Fortunately, they asked for lumbar spine also. So why I am telling you this example is, especially when there is a wedge compression fracture of L1, they have referred pain. The people may give complaint in one place, but the lesion may be in another thing. Similarly, patients with hip problems, they may have pain in the knee. They typically tell you that we have got pain of such and such a duration, and typically they tell us everything else is normal, only they have problem with the knee joint. So naturally people are not aware of these referred pains and all that. They would advise X-ray of the knee, and then they come to us with the X-rays taken and the treatment given for quite some time, and they come with those X-rays, and we tell them that the problem is in the hip. Sometimes they feel so bad that they will start questioning our intelligence. They feel I am an idiot. Naturally, when they come with pain in the knee joint and bring an X-ray and tell that they had treatment and no relief, then if you examine the patient as told in the physical examination, a joint above, a joint below should always be seen in the physical examination as well. So here the person might have missed the physical examination, or probably he might not be an orthopedic surgeon. So when the patient complains of pain in the knee, naturally they would ask for an X-ray of the knee joint, but the lesion could be somewhere else in the hip. So for this again, you will have to explain to the patient, show them why I am suspecting a problem in the hip joint by examining him, showing him the opposite hip and the difference between the two hips, then convince him and send him for X-ray of the pelvis, or sometimes could be in the spine also. So that's why don't entirely depend on the X-rays that are brought by outside for depending on the diagnosis in case of X-rays brought from elsewhere. So examine the patient. That's why I tell, even the patient comes to me with X-rays, MRIs, whatnot, and a big bunch of file, I tell them, please keep them aside, let me hear you, let me see you, then I will go back, because sometimes we may be misled, or just like I always tell the people, it's like trying to read a novel, a detective novel, from the last page to the front page. So it doesn't make any sense at all. So that's why don't straight away look into the X-rays or any investigations brought from outside if the people want your opinion. That's once again this very, very important thing. Another thing we may sometimes forget is the X-ray might have been taken long ago. For example, today I had seen a patient in my outpatient department. He was showing me the X-ray taken in September 2013 and telling me that the patient had a fall a few days back, and goes on telling me that there is no fracture. Obviously when I examined, there is a lot of pain, swelling, tenderness, everything was there around the knee joint, where the patient underwent a joint replacement about 10 years ago. So we have got to suspect under those circumstances a peri-prosthetic fracture. So why I am stressing this once again is, we might miss by unnecessarily looking into the things. Then I insisted they must get a fresh X-ray done. And the one that I have mentioned once again, that it was a poor quality X-ray, it was not taken for the proper joint properly, actually shaft of the femur was seen, nothing else is seen in the X-ray. All the bad things about which you commented, I commented, about the X-rays were there in that. So naturally I insisted upon a fresh X-ray. Of course there is no fracture luckily for the patient, and rest of the things we can manage. So simply that's why I am telling you, never be taken away by the available information provided by the patient if it comes to you for second opinion. So that's one thing. Other thing, a lot of people ask me, X-rays. Sir, I want an X-ray. You feel that the patient is not absolutely nothing that can be discovered in the X-ray, please don't advise the patient X-ray unnecessarily, because as you know, I do not have to repeat the bad effects of X-rays are there, and really patients require, there will be unnecessary overexposure, unnecessary radiation to these things. Even if the patient says I can afford to get the X-ray done, you have got to have the patience to convince the patient that the patient doesn't require X-rays. But whenever you have suspicion, please don't hesitate to take the X-rays. Then the third important question about the patient relationship with doctor as far as the X-rays are concerned. First is, I told you already, the patient would come with the X-rays that he has got. Next day asking for unnecessary X-rays. Third thing is, how often to see the X-rays. Patient has a fracture. You must have applied a plaster of Paris. Then some people ask, every week they come and ask you, sir, I want to know how my X-ray is. Can I take the X-ray? I said, I always tell them, when we feel that the X-rays are necessary, of course, lot of in countries, USA, UK and all that, where it's driven by the government or by the insurance, they don't allow. But unfortunately in our country, anybody can get the X-ray done anywhere by his choice, even though it's not correct, but it is happening. So every week also they ask us the X-ray. I tell them, unless the fracture is displaced and I have done something to put them back in position, I don't need any X-ray, because it's going to take such and such a time for the type of fracture the patient has got. So naturally I tell them it's not necessary, but sometimes still people go for the X-rays and they come back and say, sir, what you have said is correct, it's normal, but still the fracture is not related. I always tell them an example of pressure cooker situation. One keeps something for cooking in a pressure cooker. For every 2 minutes or 3 minutes, you don't open the lid and see whether the things are cooked inside or not. I tell this example and tell them, wait, when I know when to look in and take the second X-ray. These examples I am telling you to impress upon the people the unnecessary X-rays that can be eliminated and to avoid the radiation to the patients, especially young girls and young children. All these people are more likely to be affected, especially around the spine and all that, pelvis. Don't take unnecessary X-rays for girls. And similarly, especially the childbearing age group, married people with childbearing age group also don't do all those things, because they are likely to cause. And similarly for the pregnant ladies also, avoid the X-rays. So these are some of the precautions when you ask for an X-ray. Don't be just like going to a shop and purchasing a chocolate or Cadbury chocolate something and eating. It's not like that. So these things are very, very important. I am stressing you the need, getting the X-ray done only if it is needed. Then one more important thing about the patients is that they always try to argue that so and so has said there is nothing wrong. But once again I repeat, like the earlier episode where the X-ray might have been taken much earlier. So there may be change in between. So especially for an infection, for example, acute osteomyelitis, if you take it, the patient would have got the X-ray done 1 week earlier, and that might have been normal, because any changes in the X-ray following infection takes at least 2 to 3 weeks, minimum 3 weeks. So just by looking at when you have got clear signs of infection like fever, redness, swelling, tenderness, all those things, there is no point in depending upon X-ray that was taken on the day 1. You have got to tell the patient, this is the problem, we will get the X-ray done in the 2nd week or 3rd week. Of course there are other investigation methods also, but still the X-ray evidence may not be there for nearly up to 2 to 3 weeks.